Hi friends, happy Tuesday. So you may have noticed I recorded this video 10 minutes ago, and something happened where the sound was not working on my AirPods, I guess, the microphone. So we're trying again. So this is Dr. Abby here. I'm taking over the Instagram lives for the month of March on Tuesdays. I will be discussing this month. I'm going to be discussing what I do at this office. So I started at Elite in June of 2021. Dr. Lindsay brought me on because she wanted somebody that specializes in pregnancy and pediatric chiropractic. And that is what I've spent the past couple of years honing and specializing in. So when I was in school, I took all the electives and all the weekend seminars that I could in pregnancy and pediatric adjusting so that I could really get that skill down and feel really confident in it. Since I graduated from school, I have also taken a lot of other seminars. I've added some certifications to my license, and I'm in the process of adding my master's in pediatrics as well, because it just is something that I am very passionate about, and I really want to be able to offer the best care, have the best up-to-date knowledge for my patients. So you may be asking yourself, why would a pregnant patient come and see a chiropractor? And is it safe? And is it, indicated and all those things, right? So it is 100% safe. We do have a few adjustments that we cannot do or is not recommended on pregnant patients. But of course, that's why we train for this, so that we know what we can and cannot do. As long as we are doing the appropriate moves and adjustments, totally 100% safe. And pregnant patients, just like you and I, can experience some low back pain, some neck pain. They also have some unique things where, they might have some round ligament pain, some indigestion, some difficulty sleeping, some shortness of breath, things like that, right? Some inflammation. You sometimes get some swelling and edema and other things. Carpal tunnel is a very common one as well with pregnancy. Unfortunately, it does flare up during pregnancy. And these are all things that chiropractic can help with. So we do some adjusting, some soft tissue work, some things like that for our pregnant patients. We also offer some nutritional advice, some supplement advice, and things like that. It's really, really beautiful and amazing to be able to be welcomed into somebody's pregnancy journey and see that they trust us and that they're becoming empowered and knowledgeable about what they have the right to ask for, what they have the right to refuse, that they don't have to be in pain for, 40 whole weeks. They can feel better and sleep better and still be as active as they like to be before they were pregnant and feel really, really good. So it's really an amazing thing to be part of, and I really, really love it, and I'm honored to be a part of that journey with them. Another beautiful aspect of pregnancy care with chiropractic is that a few chiropractors that specialize in pregnancy will offer services during labor. So if you are doing a home birth or a birth in a birthing center, you can, for some chiropractors, they'll give you a phone number, like their personal cell phone number, that you can call or text during labor and say, I'm having some intense back labor, really bad back pain, my neck is hurting, whatever's going on. You might just want an adjustment just because you've been laboring for a few hours and you just want to feel a little bit better, right? So that is something that a lot of chiropractors will do. They'll bring their portable table over and some of their things that they might need to adjust you while you're in labor. And again, it's perfectly safe. We work with the body, with contractions and all that to make sure that you're comfortable, you are safe, and it just can help speed labor along. It can help decrease labor pains and things like that. It's a really, really amazing process to be a part of, to be allowed into that labor room and to be trusted during that labor process. So it's a really beautiful aspect. There's one of my dogs. Sorry, she's coming to say hi. So it's a really beautiful process to be a part of, and it's one of my favorite parts, honestly, about treating pregnant patients. So then we're going to move to pediatric patients. Again, with a pediatric patient, we're ranging from a newborn to, 17, almost 18 years old. That falls in that range of pediatrics. I have treated, the youngest baby I've treated has been 5 days old, I believe. I've kind of lost track. I know it's bad, but a lot of people, I have some colleagues that treat babies at, 24 hours old. They're very fresh, as I call them. you might again be asking yourself, why would we treat a baby that young? And the tagline kind of that we all say is that birth is the first trauma that occurs to humans. So it is a very traumatic event, even if it is beautiful and perfect and natural and exactly what the parents wanted it to be like, it is still traumatic. So we help that baby be welcomed into our version of the world and help kind of release any tension, any areas that need to be adjusted after that birth process. Other things that are very common for adjusting pediatric patients, things like constipation, diarrhea, indigestion. I sound like that Pepto-Bismol commercial, right? As well as misalignment of the cranium. So some parents hear their pediatrician say that they're going to need a helmet, potentially. Their baby's going to need a helmet to get that cranium nice and round and shaped the way that we expect it to be. But there are some things that chiropractors can do that can help get that cranium shaped the way that we want it to be, so that brain can have full growth and have this really nice, beautiful development, right? Other things that pediatric patients can benefit from with chiropractic, if they have sensory disorders, learning disabilities, developmental delays, primitive reflexes that are retained, things like allergies or food sensitivities, all of these things chiropractic can benefit. Again, as you learn to crawl and walk, you're going to be bumping on your butt, bumping your head, things like that. So again, chiropractic from a strictly structural bone standpoint, can help with that as well. So it's really a lot of things. And I will go into all of those a little bit more in depth in future videos. I'll explain what I mean by developmental delays and retained primitive reflexes and how chiropractic can help with that. For right now, I'm just kind of giving you a broad overview. So expect a future video where we discuss those things. But those are kind of what you can expect with pregnancy and pediatric patients and why you might bring them to us. People sometimes come to chiropractors like myself and say, I never would have thought of bringing my kid to you to help with the shape of their cranium, or to help them with, food sensitivities, or if they don't like to eat certain foods, when you're trying to introduce solid foods to your kids and they refuse to eat certain things because of the texture. That's something chiropractic can help with. And people say, I never would have thought about doing that. Like, how do I know that? So this is hopefully a video that will let you know that. And you can now, from here on out, if you have any questions, feel free to ask me, or just schedule an appointment and come on in and we can kind of talk about it a little bit more. But there's lots of benefits of chiropractic care, and I specialize in pregnancy and pediatrics, and it just is really, really amazing and beautiful, and I feel so honored to be welcomed into people's families when they trust me with their little ones and their pregnant individuals. So I am going to sign off. Hopefully this video will work this time and you all can hear everything. Thank you. I see that you have a little tip there, so I appreciate that. So it sounds like it's working, so I'm happy that no technical difficulties this time. So have a wonderful Tuesday. I will see you next week around noon, and hopefully no more technical difficulties from here on out. Okay, bye everyone.